Welcome to Comments Podcast, the show where we discuss a variety of topics with your host, Nina. One of the main implications of having successive lockdowns in 2020 has been the major impact on mental health. The effects have compounded for those who are classified as vulnerable and at high risk of developing mental health problems. Mental illness has impacted both genders and people from all ages, including young people, because mental illness does not discriminate. Many have struggled to cope during the first months of the first lockdown back in 2020, during the outbreak of coronavirus, when populations around the world were instructed to remain indoors. However, the prolonged remaining indoors only impacted mental health further, and unfortunately there may be long-lasting effects. Those who are at high risk categories with underlying health conditions, individuals who are older, the elderly, and considering shielding to avoid contracting coronavirus. These individuals have probably been impacted by loneliness and isolation due to the minimal amount of social interaction and contact available to them. Mental health problems often manifest gradually, and with many experiencing their first bout of mental health problems is usually fairly mild with the onset of depression and anxiety. However, during the coronavirus pandemic, we have spent the past year experiencing major disruption to our normal life, and albeit all in the cause of containing the spread of the virus and protecting ourselves. However, whilst a vast majority of people are able to cope with the restrictions to remain at home for a short period, others may experience increased levels of anxiety, feelings of isolation, depression, and many of these individuals would previously have considered themselves to have high levels of resilience. The sad truth is that the impact upon young people and their mental health, with the closure of schools or those from socially disadvantaged backgrounds, may also be experiencing a greater number of mental health problems compounded by the lack of social interaction. Mental health has a terrible impact on individuals at the best of times. However, multiple lockdowns has exacerbated the problem with devastating effect on mental health. Yet it is estimated that the worst is yet to come and is akin to a ticking time bomb. There is an expectancy of increased levels of mental health problems, of anxiety, stress, depression, with individuals suffering from financial worries, job loss expectancy, and prolonged periods of isolation. The problem will predictably only grow worse inevitably as a national lockdown impacts the nation's overall mental health. Many have previously probably never have suffered from mental health problems during normal times, but during this unique period of the pandemic, greater number of individuals have faced these unprecedented circumstances, and individuals feel less able to cope. It's amazing to note that on World Mental Health Day, 10th of October last year, in 2020, the World Health Organization reported the necessity to increase investment into mental health services, which is notoriously renowned for being underfunded. According to a WHO survey of 130 countries, they provided data which highlighted that 93% of countries faced major disruption in their mental health service provision. Astonishingly, the World Health Organization revealed many countries allocated less than 2% of their national health budgets to mental health. Hence, it's not really surprising that due to years of underfunding, if not decades, many countries will now find, post the coronavirus pandemic, that their mental health sectors are unable to meet the growing demand for mental health support. Mental health services will be an area that really needs to be urgently redressed by many countries, with the need for further funding. Urgent action is also required to address the issue of mental health amidst the coronavirus pandemic. Urgent funding for services needs to be put into place to deal with the escalation of mental health problems that individuals are experiencing. Local services, community support groups can only provide a safety net for those who may need access to mental health services, from counselling to referral for psychiatric services. But in the long term, for those sufferers of serious mental health conditions, they need further funding immediately. Fortunately, there has been a major media campaign in recent years to get everyone talking about mental health issues and raise awareness. It has been successful in reducing the stigma which is usually attached to mental illness, and this stigmatization prevented in the past many people disclosing that they were struggling and they just struggled to cope alone. People are more likely to seek help in the early stages before their mental health problems compound and take a greater toll on their well-being. In particular, campaigns for talking about mental health has encouraged more men to admit their mental health challenges rather than sort of maintaining a stoic facade. And this is really highly welcomed. Additionally, numerous self-help tools have become accessible online to help people manage our own mental health well-being, from meditation, positive affirmations, exercise routines, through to remote online support groups. The drivers which accelerated mental health problems back in 2020 are still prevalent in 2021 with further lockdown restrictions. However, within the UK, we do all applaud the NHS mental health services, which are still fully operational and administering support during the current lockdown in the UK. So although the coronavirus may have increased the number of mental health problems, fortunately, people are more likely to openly talk about mental health issues and seek the help that they require. Thank you for tuning in to today's episode. You can subscribe to the Comments podcast via iTunes, Spotify, and other major podcast providers. One of the main implications of having successive lockdowns in 2020 has been the major impact on mental health. The effects have compounded for those who are vulnerable and at high risk of developing mental health problems. This has impacted both genders, male and females. Mental illness has also affected young people, as this is one disease which does not discriminate. Many have struggled to cope during the first months of the first lockdown, when instructed to remain indoors. However, we have now approached our third lockdown and been instructed once again to remain indoors, and this is only going to once again impact the mental health of individuals and cause further mental health deterioration. Those who are at higher risk categories with underlying conditions, so the elderly and those with underlying problems considering shielding to avoid contracting the coronavirus and limit the numbers of individuals they have social interaction with, will inevitably be impacted by feelings of loneliness and isolation that this brings on, or shall we say shielding brings on. Mental health problems often manifest gradually, and individuals, most will have probably experienced some form of mild mental health problems with the onset of depression at some point in their lifetime. But during the coronavirus pandemic, we have spent the past year having our normal life severely disrupted, with the caveat it has albeit been in support of a good cause of containing the spread of the coronavirus and reducing the number of infections. But a vast majority of people, although they are usually have found themselves able to cope with the restrictions at home for short periods of time, it's now coming on to 12 months of us having to contend with COVID-19, and the news just doesn't seem to be getting any better. In fact, we seem to be having an escalation with the impact it's having on the NHS, and further restrictions are being considered at the moment, so we're being told. Some people are experiencing heightened levels of anxiety, obviously the consequent isolation, depression, and this is forms of mental health problems which are affecting individuals who previously would have considered themselves to be fairly, to have high levels of resilience. But it's now started to take its toll. The sad truth is that the impact upon younger people will only continue to grow. We have the closure of schools, and it will also impact those from socially disadvantaged backgrounds who may also, in the long term, experience mental health problems compounded by the lack of social interaction, which is so important within this the younger age group. Mental health has a terrible impact on individuals at the best of times, and multiple lockdowns have exacerbated the problem with devastating effect on mental health. But unfortunately, it's estimated that the worst is yet to come, and it's almost like a ticking time bomb waiting to explode. There is an expectancy of increased levels of mental health problems, ranging from anxiety, stress, depression, which will arise from financial worries, job loss expectancies with the economic downturn that's predicted, and of course, as obviously mentioned earlier, growing isolation due to the certain restrictions of lockdowns, the problem will predictably only grow worse as the national lockdown impacts the nation's overall mental health. And people who have probably never experienced mental health problems are having to contend with this during this unique period, whilst we struggle in these unprecedented circumstances. And some will unfortunately not feel able to manage and to cope. And to corroborate this, it's one fact that astonished me discovering this was that on World Mental Health Day on 10th of October last year, back in 2020, the World Health Organization reported the necessity to increase investment into mental health services, which is notoriously underfunded. According to a WHO World Health Organization survey of 130 countries, provided data which highlighted that 93% of countries faced major disruption in their mental health service provision. Astonishingly, the World Health Organization revealed many countries allocated less than 2% of their national health budgets on mental health, which is unbelievable. It's such a low figure. So it's not surprising that due to many years of underfunding, countries are now finding that their mental health sector is unable to meet the growing demand for mental health support as demand increases within their population. So mental health service is one area that will need to urgently be redressed by many countries as soon as possible, with further funding allocation. Urgent action is also required to redress the issue of mental health amidst the coronavirus pandemic. Funding needs for services needs to be put into place to deal with the escalation of people who are experiencing mental health problems and looking for further support because they're unable to manage and cope alone. Local services, community support groups, GP practices can only provide a safety net for those who may need access to mental health services, ranging from counselling to referral for more serious mental health issues, psychiatric services. But again, they're all impacted by a lack of funding and also the lack of provision locally to meet the higher increased demand for it. So for the long term, serious mental health illness sufferers do require funding of services. It shouldn't be considered a Cinderella service of the NHS and other governments. Mental health should be now seen as much a priority for funding.